This is actually an old article back from 2019, November 25th, 2019. This is ABC News. And this of course is not about the current vaccine. This is about an old vaccine that's been utilized in Africa for quite some time. It is the polio vaccine. And as you can see, the title of this article is More Polio Cases Now Caused by Vaccine Than by the Wild Virus. It says more polio cases are now caused by the vaccine than by wild virus, as 4 African countries report them. There's a real easy Google search to see who has been pushing for this in Africa. And so there is a business of selling people these products, and these products have an effect, and of course they tell you that they are for your benefit, and if you state anything to the contrary, well then you're an anti-vaxxer, right? This is what they tell you. You don't follow the science. And then a couple of years later, and then the science, or the real science, comes out. But it's Africa, and who cares about Africa, right? It's just black people. Nobody really cares about black people, especially people in Africa. They got a huge population. They got too many people over there. There's too many mouths to feed, right? You got too many mouths to feed. You've got not enough resource management, not enough resources, not enough good resource management in the continent. And people suffer. So they're just like, you know what? Let's just put these people out of their misery. We're not going to be able to feed all of them in a controlled and responsible way. So let's just create a narrative. And so, hence, this is what goes on in Africa. And it says London, it says 4 African countries have reported new cases of polio linked to the oral vaccine, as global health numbers show that there are now more children being paralyzed by a virus originating in the vaccine than in the wild. So for people who are like, that's not how they work, this is a reputable source coming from, there's a mainstream media, right? This is the mainstream media here located in America stating facts. And this has been out for quite some time. This information is not new. They're just reporting on it. And of course, year over year over year. This has also happened in places like in India as well. And ironically, it's in many of these places. And of course, these are typically not white nations. They're typically brown and black nations. All right. And then these individuals tell you that we care for the brown people. We care for the blacks. But what's the outcome, right? I often make this point about what Jesus said when he said, wisdom is proved righteous by its works. What does it produce? If someone tells you that a line of thought or a school of thought is wise, right, well, then it would show in what it produces. If it produces bad works, well, then it clearly is not that wise. It says in a report late last week, the World Health Organization and partners noted 9 new polio cases caused by the vaccine in Nigeria, Congo, Central Africa, and Angola. It says 7 countries elsewhere in Africa have similar outbreaks, and cases have been reported in Asia. Of the 2 countries where polio remains endemic, in Afghanistan and in Pakistan, vaccine-linked cases have been identified. Pakistan, right? So in areas where they don't have, you see the spread of, in essence, variants that are produced related to the vaccine. So they give these people the vaccine, and what happens is it causes variants, because the disease will find the easiest path to infection. Most diseases, most viruses want to live. And so eventually over time, they learn to live with their host, right? And so they become less dangerous. This is the natural path that most viruses go, because the virus wants to live. And so when you give people a vaccine, it kills that particular or those particular variants that, like for example, the flu vaccine. The flu vaccine works on specific variants, but that's why from year to year to year, you get a different type of inoculation because there's different variants, and all that particular one for that year works on the most common ones that they believe are going to hit specific areas. But what happens the next year? You get new variants, and so this is basically, in essence, a revolving door of repeat business, right? You don't go to the hospital to get cured, you go to get well enough to get discharged so that you can eventually come back. Moving on, it says in rare cases, the live virus in oral polio vaccines can mutate into a form capable of sparking new outbreaks. Again, this is not me. YouTube, please do not strike me for misinformation. This is information that has been put out by a news source that is stating facts. It says all the current vaccine-derived polio cases have been sparked by type 2 virus contained in the vaccine. Type 2 wild viruses was eliminated years ago. Polio is a highly infectious disease that spreads in contaminated water or food and usually strikes children under 5. Right, and so this primary can be fixed with cleanliness, giving people access. This is why they always talk about giving access to clean water in places like in Africa. But if they were to do that, if they were to give these people, right, it's like Jesus said, you give a man a fish, right? He lives for that day. What does he have to do? He has to come back the next day to get that fish. But if you teach a man how to fish, well, then he'll be able to live forever. And that's why in a lot of these places that are dependent upon the West, they don't want to give you, in essence, they don't want to teach you how to fish. They're like, we'll give it to you. We'll give you this fish for this day so that you end up having to come back for more the next day, right? The revolving door of business. And so instead of giving people and pushing, I mean, it's an easy fix to go out and create systems of clean water sources. But then it's kind of like, why that's not advantageous for them from a business perspective. There's more money, it's more lucrative to, in essence, have these people coming back for repeat business. Why? Because you got to come back every year. You got to come back for a booster. You got to come back for it's a new strain, so you need a new vaccine, right? Sounds very similar, doesn't it? Doesn't it sound very similar to what's going on today? It says about 1 in 200 infections result in paralysis. Whew, that is high. It says among those, a small percentage die when their breathing muscles are crippled because of the ascending paralysis. It says donors last week pledged $2.6 billion to combat polio as part of they give this money so that they can give them more vaccines. It says eradication initiative that began in 1988 and hoped to wipe out polio by 2000. And of course, here we are 20-something years later. Since then, numerous such deadlines have been missed. Shocker. To eradicate polio, it says more than 95% of the population need to be immunized, according to them. 95%. That is huge. Some places talk about upwards of 60% to 70%, maybe even as high as 80% is usually enough for herd immunity, because you typically end up not coming into contact with someone who is likely to be infectious. The World Health Organization partners have long relied on oral polio vaccines because they are cheap and are easily administered, requiring only two drops per dose. Western countries use a more expensive injectable polio vaccine that contains an inactivated virus incapable of causing polio. So you see right there, right? It's cheaper. It's cheaper to give these people the live virus than to give them the inactivated virus. Why? Because they can't pay for it. That's all. In the more affluent countries, right, where people can earn dollars or they can earn euros, it's to the business advantage to sell them the more expensive version. Why? Because they can pay for it. In these poor countries where they don't earn dollars and they might not have the best economy, well, you're going to get they're going to get what you can afford. It says the Independent Monitoring Board, a group set by the World Health Organization who assesses polio eradication, warned in a report this month that vaccine-derived polio virus is spreading uncontrolled in West Africa. It says bursting geographic boundaries and raising fundamental questions and challenges for the whole eradication process. The group said officials were already failing badly to meet a recently approved polio goal of stopping all vaccine-derived outbreaks within 120 days of detection. This is back in 2019, right? This is prior to everything that's happened today. So you can imagine how much worse the conditions are in Africa today. It says it's described the initial attitude of the World Health Organization and its partners to stopping such vaccine-linked polio cases as relaxed, and said new thinking of how to tackle the problem was needed. It says the story was corrected to show that on the part of two polio epidemic countries, Afghanistan and Pakistan, only Pakistan has reported vaccine-derived polio cases. With that said, we can take a look at this new article, right? This article just came out recently. This article is from today. It says Malaysia shuts vaccination center after 200 workers were infected. It says, this is according to Reuters. It says C-19 vaccination center in Malaysia was ordered to close for sanitation on Tuesday after more than 200 volunteers and workers there tested positive over the weekend, the country's science minister said. So while the article doesn't state whether these workers had taken it, it can be deduced that those who are working in an area as health professionals and who are offering said product have already partaken of said product, right? If you're telling people you need to take this to stop the spread, well, then more than likely as a healthcare worker, you have already taken it. And of course, these individuals are now testing positive. The ones responsible for administering said medication have now come in contact and are infected, even after the fact that they've supposedly been inoculated. At the very least, we can deduce that. It says those inoculated from the 9th to the 12th of July at the center, about 25 kilometers outside of Kuala Lumpur, are advised to self-isolate for 10 days. Minister Kerry Jamuluddin told reporters. Says the facility has a capacity of about 3,000 doses a day. Of the 453 workers and volunteers screened, 200 tested positive, almost half. The incident comes as Malaysia struggles to contain its biggest outbreak yet, with record deaths and cases amid a ramping up of its vaccine program and stricter lockdown measures over the past month. Right? And I want you to pay attention to this part. It says at 844,870 cases overall, Malaysia has one of Southeast Asia's highest per capita infection rate, but also has its highest rates of inoculation, with 25% of the population of its 32 million population having already received at least one dose. Says the center will resume vaccination on Wednesday after sanitation and a change in staffing Kerry added. And we're going to leave that right here. We're not going to do too much commentary so YouTube doesn't get triggered, but you can deduce your own reasoning. I will link both of these articles down below for your personal reading. Feel free, of course, to like, comment, subscribe, and carry on the conversation. And I will check you out next time. Thank you for watching.